Yeah, one of the emerging areas in our rare disease space is even more rare subsets of a rare disease. So I'm an adult physician, but we do have lots of questions about pediatric age patients. And I think what's very important is that even in a rare disease, this may be an even more rare subset. So we've partnered with our pediatric oncologists around the world to try to develop an algorithm and an understanding of BPDCN and try to compare and contrast essentially what are those features. And so we presented some initial findings. I think the two things that we've noticed is that number one is that they don't appear to be exactly 100% the same disease, so for whatever reasons those are, we need to investigate. And number two, that we have treated more than a handful of patients now with CD123 directed therapy. And so we just showed the feasibility that that's possible. Notably, the Tagraxofusp agent is approved in the US for ages 2 and older, and so we'll understand more about this population as time goes on.